So today I want to go over different implant position and what that means for your explant operation. So there are two main places you can put an implant. You can put the implant above the muscle. This is called subglandular, or you can put the implant below the muscle. That's called subpectoral. Subpectoral is probably the most common way it's done in the United States. Outside of the United States, subglandular is probably the most common way that it's done. There's nothing wrong either way, but I want to tell you what that means as far as the explant goes. So when it's above the muscle, this is your breast tissue, this is the implant, this is the pec major muscle. So it's above the pec major muscle. That's why it's called subglandular. So what does that mean? Well, that means that this implant's sitting right underneath the breast. So technically, it's a little bit easier to do a capsulectomy because you're pulling it off of the pec muscle below it and off the breast tissue. That's just a little bit easier to do. It generally hurts a little bit less for the patient because it does pull off a little bit better for people. It bleeds a little bit less, so the drains don't have to stay in quite as long either. The main disadvantage of a subglandular or above the muscle implant, when you take it out, there's more risk of deformities to the breast because it's directly stretching the breast. So once the implant's gone, there's a bigger deflation that happens. Now the opposite is true is if it's underneath the muscle. So this is the pec major, this is the implant, these are the ribs. And between the ribs, you have your intercostals. So that's right on top of the cage, the rib cage over there. So when you're taking this off, it's a little bit more technically difficult to do the capsulectomy because you have to be more careful around the rib surface over there. It does hurt a little bit more because you have this kind of deep burning pain along the chest wall. The drain stayed a little bit longer because it does bleed a little bit more as well. But the main advantage to it is cosmetically, it tends to look a little bit better because the implant is directly being kept down by the pec major. It's pushing it against the chest. So it's not extending and stretching the breast as directly. So when you take the implant out, there's less of deflation that happens. So those are the two main positions of breast implants and basically what it means as far as when you take the implant out, what that looks like as far as the pros and the cons.